Good day. Today we are going to discuss about the subject from Form D third year pharmaceutical formulations. The topic one from the course syllabus, uh, pharmaceutical dosage forms. So here this discussion is going to be presented by me, Dr. Jeevanandam, Professor, Pharmaceutics Department, as two parts. Since being an introduction unit, part 1 and part 2 carries the information about classification and concept of pharmaceutical dosage forms. What is a dosage form? Pharmaceutical dosage form can be defined as a physical form of a drug, such as a solid, liquid, or gas, by which it can be delivered in proper form to particular sites within the body. So, based upon this, the dosage form is going to be split into two types of classification based upon the concept. One is the physical form, another one is the route of administration. So, what is the need of a dosage form? Protection to improve the therapeutic activity and to overcome the unwanted extra doses. So, the protection, what is the protection? Protection from external environment such as tablets can be coated and sealed ampoules for parenterals. Protection from degradation because of gastric juice. To improve the therapeutic activity, to provide optimal drug action directly to the site of action. Example, ointments. To place the drug directly in the orifice like vaginal or rectal. So to provide optimal drug action in the bloodstream. To provide rate controlled drug action. Example, modified release dosage forms. And the last point, to improve the bioavailability of drugs with narrow absorption window. Example, gastrorectal dosage forms. To improve the patient compliance. So to maintain accuracy of dose, example, unit dosage form can be suggested. Reduction in frequency of dosing, example, SR tablets and controlled release tablets, controlled release drug delivery systems. To improve the physical properties of drugs, example, coated dosage forms, easy for handling and administration. Classification of dosage forms. So dosage forms can be classified according to the route of administration and physical form. That is oral, topical, parenteral, rectal, vaginal, inhalation, ophthalmic, aortic, nasal. Liquid forms in physical nature form, liquids, semi-solid, solids, gases. So classification of liquids. First, today in part 1 we are going to have the detailed discussion about what are all the available liquid forms in monophasic and biphasic liquids and how it is classified into. So the liquid dosage form can be classified into two major classes. That is, one is monophasic liquids, second one is biphasic liquids. In monophasic liquids, here, solutions. Monophasic dosage form refers to liquid preparation containing two or more components in one phase system. It is represented by true solution. Solutions are clear, homogeneous liquid preparations intended for internal or external use containing one or more active ingredients dissolved in the suitable vehicle. The component of the solution which is present in a large quantity is known as solvent, and whereas the component present in small quantity is termed as solute. So monophasic liquid dosage forms are classified into liquid meant for internal administration. Here syrups, mixtures, elixirs, agents. Liquids applied to skin, lotion, liniments, collagents, paints. Used in the mouth, So main is external, internal. In internal we have seen the subtypes. In external we are going to see the second one, liquids used in mouth, gargles, mouthwash and throat pains. Liquids which can be installed in the body cavities, elixirs, dosages, ear drops, eye drops, or lot of types in external form and internal form. Here you can see the syrup. Syrups are aqueous preparations containing 60 to 85% sucrose with or without flavoring agent and medicinal substances. Example: chlorpheniramine malate syrup, chloral hydrate, flavored syrups, and medicated syrups. Mixtures. A mixture is a liquid preparation meant for oral administration in which medicament or medicaments are dissolved or suspended in suitable vehicle, not used for long period of time. Prescribed for acute conditions like cough, digestion, and diarrhea, constipation, etc. Elixirs. Elixirs are clear, aromatic, sweetened hydroalcoholic solution with or without medicinal substances intended for oral use. Example: dexamethasone elixir. The vehicle may contain a high portion of ethanol or sucrose together with antimicrobial preservatives which confers the stability of the preparation. Linctures or viscous liquid oral preparations that are generally prescribed for relief of cough. Example: codeine linctures. Linctures contain medicaments which have a demulcent, sedative, and expectorant action on the membranes of the throat. The dose volume is small, 5 ml, and to prolong the demulcent action, they should be taken undiluted, sipped, and swallowed slowly. So further, uh, lentas contains medicaments we have seen here, and for the next type of solution, lotions or preparations, liquid preparations meant for external application without friction. Local action as cooling, smoothing, or protective purposes. Aqueous and non-aqueous lotions, alcoholic lotions, and used for cleansing, moisturizing, and antiseptic lotions are there. Liniments are liquid preparations meant for external application on the skin with the friction and rubbing. Alcoholic or oily solutions and emulsions. Analgesic, rubefacient, smoothing, and counter-irritant actions are prepared in liniment form. Collidants are liquid preparations for external use containing pyroxylin in a mixture of ethyl ether and alcohol to protect the wounds and cuts. Gargles or aqueous solutions used to prevent or treat throat infections, available in concentrated forms and are to be diluted with warm water before use. So each and every preparation, I used to mention the pictographical representation for the administrative containers or the package form, the finished products package photos below the description. You can have a look at it. And these are mouthwashes. Next, these are aqueous solutions with pleasant taste and odor used to make clean and deodorize the buccal cavity. Antibacterials, alcohol, glycerin, sweetening agent, flavoring agent, and coloring agents are used for mouthwash. Throat pains. Throat pains are viscous liquid preparations used for mouth and throat infections to adhere to the mucous membrane for a long period. In this, glycerin will be used as a base for the preparations. Dosage is a medicated solution meant for rinsing body cavity containing antiseptic or astringents. Vaginal cavity, eyes, ear, or nasal cavity for cleaning or removing foreign particles or discharge from them is used. Powder or tablet form or concentrated solution form may be used. Feminine Doge is the markedly available product. Eardrops. Eardrops are the aqueous solution that are installed into the ear with a dropper. So cleaning the ear, softening the wax, and for treating the infections, these may be used. Nasal drops. These are the aqueous solutions that are installed into the nose with a dropper. No oily vehicles is used. It is used especially for lipoid pneumonia. Eye drops are the sterile aqueous preparations that are intended to be installed in the eyes. Isotonic, and it should have suitable pH. Enemas are aqueous or oily solutions or suspension that are introduced into the rectum for cleansing, therapeutic, or diagnostic purpose. Biphasic liquids. Biphasic liquids are two, the major we are using: emulsions and suspensions. Emulsions are the biphasic liquid dosage forms containing two immiscible liquids that are made miscible by addition of surfactant in the name of emulsifying agent. The types mostly used is oil in water type emulsion and the water in oil type emulsion. So the last one in the first part discussion is suspensions. Suspensions are the biphasic liquid dosage forms of medicaments in which the finely divided solid particles are dispersed in a liquid vehicle. Example: oral suspensions, parenteral suspensions, which can be given in injections, topical suspensions, ophthalmic suspensions. So, as a continuation, tomorrow we will discuss about the pharmaceutical dosage form concept and classification with unit dosage form, that is solid dosage form, which may be named as unit dosage form for tablets. So quite interesting. The class tomorrow will be continued in the part 2. We will have further detailed discussion about pharmaceutical dosage form. Thank you. Thank you all.